Welcome back to Good Day. This month marks Mental Health Awareness Month, and nearly 1 in 5 Americans live with a mental health condition, according to the National Institute of Mental Health. Now, this includes things like depression, anxiety, and mood disorders, including bipolar disorder. NAMI Central Texas is hosting and holding various activities this month to help raise awareness about mental health. And joining us to talk more about this are Greg Hansch, Executive Director of NAMI Texas, and Brianna McKinney, Interim Executive Director with NAMI Central Texas. Thank you both so much for being here today.
Thank you so much for having us.
Yeah, so Brianna, we'll start with you. Tell us a little bit about, both NAMI. Tell us a little bit more on how NAMI Central Texas helps our community here, and what is it really?
Yeah, well, NAMI Central Texas does a really good job of creating community around mental health, and what that means is that we do those things through support, education, and advocacy, and we do that not only for people living with a mental illness, but for those loving someone with a mental illness, whether you're a parent, a teacher, a spouse. We create community and have everyone come together around mental health.
Yeah, why are these conversations so important? Greg, you are part of the agency at a state level. Tell us a little bit more about what y'all do.
So mental illness is heavily stigmatized. There is a discrimination against mental illness that we see, a lot of false beliefs and misconceptions. So we're here to paint the reality of what mental illness looks like, how it manifests in individuals and families' lives. On the state level, we do a lot of advocacy work at the state capitol. We have our Capitol Day rally coming up tomorrow on the South Steps at 12:30 p.m. And we've been active throughout the legislative session to try to increase access to services, to try to hold insurance companies accountable for paying for care, and to try to address the significant mental health workforce challenges that we have in our state, where 2/3 of counties don't have a single psychiatrist. We need to act for mental health and address these policy challenges.
Yeah, tell us a little bit more, Brianna. Greg mentioned this incredible stigma that tends to happen, and oh, we don't talk about this. Tell us a little bit more about the activities y'all have planned for the month of May to really change that and make it more of a normalized conversation.
Absolutely. Well, the pandemic did a lot of things, and one of the good things it did is really raise more awareness for mental health. And there is still a stigma, though, so we still have a lot of work to do. But today kicks off Mental Health Month, and we have a lot of activities coming up. We serve a 6-county region, and so we're going to have coffee shop conversations all across the 6-county region. And then on May 18th, we're having an amazing event called Speak Up, and it really is about speaking up. So we're going to have vocal artists and recording artist Courtney Santana is going to be there. She's going to be doing a performance and then also sharing her story of mental health. And then we're going to have an art gallery of local artists, local visual artists coming to share not only their art, but the intersectionality of art and mental health, and how those artists have really used art and their creative expression to help themselves through their mental health journey as well.
Yeah, Brianna, can you share a little bit of the distinction between mental health and mental wellness? Is there a difference in that?
Sure. Do you want to talk to that a little bit, Greg?
Yeah. So, mental health means that you're thriving and you're working towards the best version of yourself. And I think mental wellness, is a tool that you can use to get towards that positive state of mental health. And mental illness is a diagnosable and discrete and treatable medical condition. So these things sort of exist on a spectrum, and we're trying to move people in that direction of full mental health and mental wellness.
Yeah, and tell us a little bit more. The number you said earlier, there are some rural counties that don't have the help that folks need. Are there any bills right now that are moving through the legislature that help address some of this?
Yeah, there are a number of bills that we're supporting and are working to pass in this legislative session. Senator Colcourse has filed SB 26, which will hold the mental health system accountable, provide more transparency into the outcomes that the mental health system is achieving, and also provide more resources to make sure that people are getting the right level of care at the right time. We're also working for legislation that would require insurance companies to provide reimbursement for the best practice in services for people experiencing a first episode of psychosis. And then the legislature has proposed, and we fully support, increasing the funding for the mental health student loan repayment assistance program to bring more people into the profession and make sure that we have the supply of mental health professionals that we need to meet the demand.
Yeah. Would you say Texas is facing a mental health crisis right now?
Absolutely. Yeah.
And so moving forward, what do you want people to really take away from this month of May?
Oh gosh, take some sort of action in your life, right? So it's called Mental Health Month. Greg and I were just talking about this. It's called Mental Health Month instead of Mental Health Awareness Month because it's about awareness, but it's also about action. So taking action, do something to support your own mental health, mental wellness, whatever that means for you during this month, because it starts today.
Yeah.
And so whether that means getting outside, taking a walk, getting together with friends, social connection is really important, or coming to our event on May 18th and really, speaking up, sharing in conversation. Tickets are available on our website, and everything that we're doing this month is available on our website, NAMICentralTX.org.
Okay, perfect. Thank you both so much for talking about this and doing this important work. Myself, this is something that is near and dear to my heart. I work with a therapist, and I also believe in normalizing the conversation. So
yeah, well, thank you for saying that. So you help normalize it.
Yeah, absolutely. All right, thank you both for coming.
Thank you.
Back on Good Day.